Normal ECG will have normal QRST wave, and in acute MI there would be just ST elevation. Within hours of ST elevation, there would be decreased amplitude of the R wave and Q wave will begin to appear. Within 1 to 2 days, T wave will get inverted with the deeper Q waves, and a few more days, ST will normalize and T wave will still be inverted, and after weeks, ST and T wave will become normal, but Q wave will persist. Reciprocal changes. Posterior ST elevation will lead to anterior ST depression. Anterior ST elevation will lead to inferior ST depression. Inferior ST elevation will lead to lateral ST depression. Lateral ST elevation will lead to septal ST depression. Lateral ST elevation lead to septal ST depression, while septal ST elevation lead to posterior ST depression. So the evolution of ECG changes in myocardial infarction from our hyperacute phase at 12 hours T wave inversion, at 24 hours, and at 96 hours there would be deeper Q waves with T wave inversion. So before coronary occlusion there is a normal ECG, and with the onset R wave is normal or nearly normal. ST elevation with peak T waves. On the first day, R wave amplitude will diminish, Q wave will appear, and ST elevations will be more marked. On first and second day, R wave gone or nearly gone with significant Q wave, slight ST elevation with T wave inversion. After 2 to 3 days, there would be no R wave, deep T wave inversions with marked Q waves, and after several weeks, there would be some R wave which may return with significant Q waves, T waves often less inverted, and ST elevation may persist if aneurysm has developed. This is another picture of ECG evolution in non-reperfused MI. First, there is a peak T wave with progression of ST segment elevation in minutes to hours, with loss of R wave and Q wave formation in hours to days, with T wave inversion in days, T wave normalization with persistent Q waves in days, weeks, or months. Timing. Stage 1 acute occlusion. The present ECG may be recorded at any of these stages. In stage 2 reperfusion, and in stage 3 restoration of cell metabolism. With necrosis, without necrosis in 2B.